Okay, so this is the psychosocial impact of atopic dermatitis. So AD is a chronic skin disease that affects the lives of patients and families. Many studies show that people with AD and their caregivers and family members have a low quality of life. The impact, this impacts daily activities, sleeping habits, and causes higher levels of fatigue, stress, and depression. The stigma surrounding the disease contributes to the decreased interactions between patients and like other individuals. So in this article, they review the tools being used to assess quality of life and the impact of atopic dermatitis on patients. So, tools. The creation of the quality of life scale by Flanagan um, is talked about in this article, and it talks about how it's been adapted for several chronic illness groups. Um, this scale, along with the health-related quality of life scale, have been used in conjunction with measurements of disease type and severity to understand the social, emotional, and psychological impacts of the disease. These instruments are readily available to measure the impacts of the chronic skin disease, like for anyone. The burden of skin disease includes physical comfort, embarrassment, and social stigma, and etc. The the health-related quality of life scale is used to understand how one aspect, like itching, affects other aspects like sleeping. And the dermatology life quality index is another tool, and it is like a 10-question survey that was designed to be a practical questionnaire for like clinical use. And there's different ones that like have been made. There's one for children, there's one for um, infants, and then there's like adults. So then they reviewed the current literature and quality of life like in AD patients. And so it starts with children and says that AD affects many physical and social and emotional aspects of a patient's quality of life, and this makes it more of a burden than any other chronic illness because it affects so many things. There's things like itching, scratching, bleeding, um, pain, there's like dietary limits, there's emotional impacts like behavior problems, there's crying, there's stress that is associated with like the medical treatments. There's like it interferes with activities like bathing, swimming, playing outside, things that normal kids should be doing. Um, and then there's like a stigma associated with this. So like adults and children like often avoid interaction with these kids with eczema because they like think it's contagious. And then the parents of these kids isolate themselves from like family members and friends to like avoid unsolicited advice about like their kids' skin and their treatment. Um, and so yeah. And as the severity increases, the quality of life gets worse. And so in adults, and it's all these things. Well, first of all, atopic dermatitis persists into adulthood and can onset later in life. And so, in addition to the limitations children have, now adults have limitations in the workplace and intimate relationships. Um, they feel that it impairs their social life. The appearance of eczema has an impact on on patients' sex life, and they feel that there are clothing limitations because of like their visible eczema. So stigma. Chronic diseases lead to negative self-perception and experiencing stigmatization. So basically, stigmatization in skin disease is the presence of like skin lesions which lead to a person feeling like judged, and they feel like they have a lack of acceptance. And so this is connected to what I said before, where like people isolate themselves so they wouldn't get advice or like be judged. And then also bullying and teasing is connected with this skin condition, and atopic dermatitis also affects self-confidence. So in summary, impacts on like it has a drastic and like dramatic impact on quality of life. Patients suffer with like a very low quality of life. Sleep and itch play a large role in like disruption of normal activities, and stigma can create negative social environments, and impair relationships.